We're going to learn more about pelvic health and therapy. Joining us today from Mercy Health St. Rita's, to my immediate left, occupational therapist. We have Alyssa Heckman, and she is a physical therapist. Next to her, Jamie Ebbeskotte. And thanks for coming today, both of you.
Thanks for having us.
Okay, so first of all, I was like, pelvic health, what is that all about? So what is the difference between outpatient therapy and then pelvic therapy?
Yeah, so we at St. Rita's, we have our outpatient department where you'll see physical therapy, occupational therapy, or speech therapy for things like, hip replacement, shoulder surgery, stroke rehab. And then we have our pelvic health clinic where we see solely pelvic floor related conditions in our clinic.
So is that mainly a female thing? Because, everyone has pelvic, right?
Yes. No, so we see male, female, and even pediatric patients of all ages. Really everybody can benefit.
All right. So what are the types of, you just mentioned ages, so what are the type of things that they're diagnosed with that you can help?
Yeah, so we see patients, like I said, male and female, and then pediatric patients with anything like urinary frequency, urgency, leakage, constipation, fecal incontinence, things like that. And then abdominal pelvic pain. So you always hear like endometriosis or pain with intercourse, things like that. And so these are not the most fun things to talk about, but we have a very discreet clinic where everything is made as comfortable as possible. And so we also see our pregnant and postpartum patients as well.
Yeah, you mentioned these are things you don't really want to talk about. Really, when you mention those things, I like, well, I didn't even know you could help for that. And it's just like, people have to live with that.
No, and everybody, I always joke, everybody could use a little sprinkle of pelvic health in their life at some point or another, so.
We say that a lot of people are dealing with these bowel issues, bladder issues, and they just think that it's normal. But just because it's common doesn't mean that it's normal. So there's things that you can be referred to us and we can help you with.
So does it take a long time? Do you give us exercises? Kind of what, how does it work?
It's patient specific. So if you're coming to us for pain, we'll probably do more stretching things, manual therapy. If it's more like an incontinence leaking, it might be more strengthening, things like that. But it's very patient specific. And you might come with one thing and we're treating you for another thing. And it's just different than when you go to an outpatient therapy where you might come 2 or 3 times a week for X number of weeks. Us, it's patient-based, so we might see you more like once a week or once every 2 weeks. We give you homework, you go home, you do it, you come back to us and we give you new things, we see how you're doing, and we kind of build as we go.
Oh, that's kind of cool. Homework, I like that, because I guess that probably matters though, right? With the kind of therapy you're talking about, you got to do some stuff at home, not just when you're with you.
Definitely. Absolutely.
Homework, very important. Okay, so pelvic health, I think this is just something, like you said, that no one wants to talk about. So how do you guys get into this? Just by being into the therapy program?
Well, so all of our therapists have their physical therapy or occupational therapy degree, and then there's special training on top of that. So there's certain coursework that's offered, and you go to that and you get certified and specifically trained for all these diagnoses. So all of our therapists are trained in all of these, including pediatrics. We have one therapist that does pediatrics, and we can treat whatever condition their physician sends our way.
Just to know, there is help out there. Thank you both very much for telling us about it today.
Thanks for having us.
All right, don't go away. New Tradition continues in a moment.